All right, let's begin. Hello, everyone. Welcome to today's webinar, which is part of the Private Water Network's Groundwater Treatment webinar series. Thank you for joining us. My name is Reem Tariq. I am the Senior Project Coordinator at NEHA. I also serve as the Lead Administrator for the Private Water Network. Before we get into the details of the webinar, there are just a few things I'd like to address about the network itself. If you're not a member of the network and are curious about learning more what the network has to offer, then let me inform you that the network is a virtual community of public health professionals and safety workers that work with private drinking water systems. The network was launched by NEHA in partnership with the CDC as well as NNPHI. The mission of the Private Water Network is to build a sustainable community for those working to support private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing and emerging issues, as well as to build capacity to do the work more effectively and efficiently in order to protect the public's health from contaminants in private water sources. Membership to the Private Water Network offers access to the virtual community platform that offers features such as a member directory, a resource library, an events calendar, and a discussion forum. Uh, Please note that this resource is free to anyone who'd like to join. And with that, we can get into the details of the webinar. So, the Private Water Network is doing a monthly webinar on treatment concerns and options on existing and emerging private water contaminants. We're calling the series the Private Water Network Water Treatment Webinar Series, which is what you're watching today. So, the title of today's webinar is Radionuclides Treatment in Private Wells. We thought this would be particularly timely since January is celebrated as the National Radon Action Month, and we do happen to be in the Radon Awareness Week. Radon is one of the naturally occurring contaminants exceeding standards in private wells in the US and abroad. Testing of private wells in Wake County, North Carolina, indicates that the naturally occurring uranium and radon exceed health based standards or guidelines in over 10% of the wells in the county, which is what our presentation is about today. So, the presentation today will cover the Wake County's response to this challenge and the lessons learned. Our speaker today is Evan Kane. Evan serves as the manager of the groundwater section of Wake County Department of Environmental Services. He oversees the county's programs for permitting and inspection of private water drinking water wells and programs for outreach, testing, and technical assistance for private well users. Prior to joining Wake County's Department of Environmental Services, Evan worked for the North Carolina Department of Environmental Quality for about 14 years, developing and implementing programs for groundwater protection and groundwater monitoring. He's also worked for North Carolina's Geological Survey, mapping the geology of western coastal plain and eastern Piedmont of North Carolina, and a private environmental consulting firm where he was assessing the groundwater contamination at manufacturing sites. Evan is a North Carolina licensed geologist and has a bachelor's and a master's degree in geology from North Carolina State University. Some housekeeping rules before we begin. This session is being recorded. The recording will be uploaded to the Private Water Network's resource library after the webinar is done. We will also share links to any resources that were mentioned in the webinar, and we will include those links in a follow-up email. Please do use the Q&A box to drop your questions, and you can do so as Evan is presenting. But do note that we will respond to the questions towards the end of the webinar. At the conclusion of the webinar, you will be directed to a short evaluation survey. Please do complete that brief survey to help us plan and improve for future providings. And with that, I will hand it off to our speaker today, Evan. The floor is yours. I will stop sharing my screen So you can share yours.
Okay. Thank you, Reem. Okay. Does that look good?
Hmm.
Everybody can see that? Okay, great. Um, Thank you for that introduction, Reem. Um, so you've had a pretty complete introduction to me and who I am. One thing I'll note, in case it's not obvious, the Wake County Department of Environmental Services is part of the local health department. We, our local health department is divided up into a public health division and then a separate department of environmental services where we implement everything from the municipal solid waste landfills, animal control, and waste on-site wastewater and private well programs. As we mentioned, we've had quite a bit of experience with radionuclides and private wells within Wake County over the past few years. So I will be sharing with you some background about our county and the radionuclide issues that we have found here, what we are doing about it, and because the focus of this webinar series is on treatment, some of the aspects of treatment that we have learned about, some of the challenges that we are trying to help residents deal with. So a little background on Wake County. It is the capital county of North Carolina. We have about 1 million residents, and we're adding about 56 new residents every day. We're located in the Eastern Piedmont Physiographic Province. Um, for the geologists in the crowd, we'll touch on geology a little bit more and as we go ahead. Um, Water supply situation in Wake County. The majority of Wake County's residents are served by public water supplies. These are systems that are regulated under the Safe Drinking Water Act. They have regular monitoring requirements. They have certified operators, et cetera. But a substantial proportion of Wake County residents, about 150,000 residents, are served by private drinking water wells as their primary water source at home. Within Wake County, those wells are regulated during their initial construction. We've been permitting the placement of wells since 1987 and have added water quality testing requirements as the years have gone by since then. But once that well is installed and that initial construction has been inspected and approved, the well owner becomes responsible for the maintenance and monitoring of that water supply from that point forward. Um, so in total, we have about 40,000 wells around the county. That's an estimated number based on property attributes, things like that. We have not physically observed or inspected all 40,000 of those because many of them predate our permitting program. And so that's a rough estimate. But over the years, we have been operating a more and more comprehensive well water testing program for new wells, which have requirements for testing, and for existing wells where residents have concerns and want to have their water tested. We really started fairly comprehensive testing, routine testing in about 2004 when we added, in addition to the coliform bacteria testing requirement that we had in place since 1987, we added requirements for nitrate and heavy metals and a few other constituents. And since that time, we've been adding more things, both in response to contamination incidents and just requests for voluntary testing. We've been adding in man-made contaminants like pesticides, volatile organic compounds, and so forth. And even based on the recommendations of a consultant that we hired in the early 2000s, we did a countywide survey of uranium concentrations in about 400 wells. So we have a fairly comprehensive data set that we've been maintaining for a number of years, but a few years ago, we kind of stepped back looking at program priorities and took a comprehensive look at the data that were in there. And this is a snapshot of what that data assessment looked like. The percentage of exceedances for various contaminants surprised us a little bit when we looked at the whole data set. Fecal coliform, which has been the focus of private well programs for decades, is actually a very rare contaminant, as well as nitrate, uh, chlorinated solvents, and pesticides. And this data set even includes a couple of places where we did intensive investigations in response to known contamination. Um, but the uranium data that we had from testing of about 400 wells showed that over 10% of the wells that we had tested at that time were exceeding the drinking water standard for uranium. So we took this data and used that to kind of reprioritize some of the issues in our county and how we operate our well program. Um, and we'll talk a little bit more about that in the next couple of slides. From mapping that initial uranium data set, we can see that it predictably occurs where we have fairly young granitic rock, the largest pluton on the East Coast, another superlative for Wake County and Raleigh, North Carolina. The Rollsville granite is a Pennsylvania aged granite that's enriched in uranium to begin with. And then it has also geochemically altered and intruded some of the surrounding metamorphic rocks nearby. So that appears to be our source there, is naturally occurring granitic source. And we recognize that uranium is really just the start of a decay chain that leads to creation of multiple radionuclides that give off radiation, alpha and beta particles throughout the decay chain. And there's a lot of radionuclides on here. I won't get into every single one of those, but from looking at the various activity levels, the drinking water standards and research that's been done, the primary radionuclides we're concerned with in Wake County are going to be that uranium that starts off the decay chain, but also radon and radium. And looking at the health risks of those, it's important to think about what the thresholds are, the potential health risks, but also the routes of exposure. With uranium, the primary risk from uranium is actually associated with its behavior as a heavy metal, leading to kidney toxicity, and not so much its radioactivity. If the drinking water standard for uranium were set based on radioactivity, it would probably be somewhere in the hundreds of micrograms per liter, but its effects on the kidney as a heavy metal begin at a much lower threshold. And so a fairly protective drinking water standard of 30 micrograms per liter has been set for uranium. There is a standard for combination of radium-226 plus 228 at 5 picocuries per liter. Main health risk there is through the ingestion route, leading to risk of cancer, especially bone cancer. And lastly, radon in water. We have two exposure routes we're concerned with, inhalation, of course, and also potential increased risk of stomach cancer from ingestion. There have been a lot of studies of radon in water associated with the EPA attempting to set a drinking water standard for radon several years ago. The EPA never did set a drinking water standard for radon, but that spurred a lot of studies by the National Research Council and others. Within North Carolina, an interagency group called the North Carolina Radon and Water Advisory Committee studied this issue extensively. And thanks to hard work by Ted Campbell with the North Carolina Division of Water Resources, they assembled an excellent report in which they really identified two thresholds for potential action on radon in water at 4,000 picocuries per liter, which was one of the EPA's proposed standards, and another at 10,000 picocuries per liter. So I have one number shown here on this slide that doesn't really tell the whole story on radon in water. If you look around at other states, you'll see different thresholds, and it's a complicated matter to deal with since there is not a single drinking water standard that we can point to. But we'll consider some of those complexities as we move ahead here. The main thing is radon, as most people know, can come into your house through the soil underneath the house. And regardless of the type of foundation you have, whether you have a crawl space, a slab, or a basement, radon from soil vapor can be a significant source of radon entering the house. If you also have a private drinking water well as your water supply, or any groundwater supply, radon can also enter from the water supply anywhere that water is used in the house, showering, laundry, washing the dishes, etc. And so it's important when we're looking at radon in water that we not overlook the soil contribution and evaluate that at the same time. And this is sort of the driver of why there's so much uncertainty around what standard to set, or what threshold to recommend to people regarding radon in groundwater, because so much can depend on the soil contributions. We also know that the geology doesn't recognize the county boundaries. This map just shows eastern Piedmont counties of North Carolina and the granitic rock that we know is present in them. So in purple there, Wake County has a big chunk of that Rollsville granite. Rollsville granite extends up throughout Franklin County and is joined by other granitic bodies there and in other counties. And looking out statewide, again, this is work by Ted Campbell with the Division of Water Resources and Phil Bradley at the Geological Survey, looking at susceptibility to radon in groundwater in North Carolina. There's a number of areas with elevated susceptibility throughout the Piedmont and into the mountains of North Carolina. And within Wake County, we've done, in some neighborhoods, fairly extensive testing that shows us a lot of local variability from well to well. We can see here in this map that we have a number of wells in one neighborhood that are, in terms of gross alpha activity, which is a proxy for uranium and radium-226, number of wells more than 10 times the drinking water standard, and sandwiched in between them are wells that meet the drinking water standard. And if we extended this out to other parameters and considered the radon contribution and uranium contribution, we would see just as much variability from well to well there, where one neighbor has high radon in their water, but no uranium. And next door, they may have uranium and radon. Next door to that, they might not have any issues with any of these radionuclides. So it's very well specific, in part because of the fractured bedrock aquifer that we are tapping in Wake County. So taking all those things into consideration, we have a problem. What are we doing about it? So after doing our initial data assessment back in 2015, 2016, we published a recommendation for voluntary testing for anyone living in essentially the eastern half of Wake County. We recommend that they have their well tested in addition to the basics of coliform bacteria, heavy metals, and nitrate, and those sorts of things. We recommend what we call the RADS package. We chose a simple name because we figured the specific tests were easy for your layperson to lose in translation. So they can simply ask for this as a service from the county. That RADS package, though, includes uranium, specific testing for uranium levels, gross alpha activity and gross beta activity, radon in water, and also radon in the indoor air. What that looks like for us as field staff delivering this service is we collect water samples preserved with nitric acid for the uranium and the gross alpha. And in zero headspace vials, we collect sample for radon and water. But we also, at the time that we collect the well water sample, we deliver to the homeowner an inexpensive air test kit and recommend that they use that to test their indoor air levels. And that's again because the radon may be entering the house not only through the water, but also through the soil underneath the house. And we want people to have that complete picture so that they can make the best use of limited funds when it comes time to fix problems with radon. We also added in 2019 a new rule for testing of new wells and existing wells serving new construction within the county that requires testing of those wells for gross alpha and gross beta activity. And this is essentially a proxy for uranium and to a lesser extent radium. We did not add a testing requirement for radon in new wells. We considered this pretty closely, and I think the major driving force behind the decision not to adopt a requirement to test for radon in new wells was the fact that the soil contributions may be the more substantial contribution of radon to the home, and we do not have a radon resistant construction requirement at this point in the county. And so we looked at the possibility that we may be incurring significant costs for mitigation of radon in the well water while missing a major source of radon from the soil underneath the house. So that's an area that still needs some policy development work to make sure that we're not missing a substantial, potentially substantial health risk. With all that in place, we still recognize that with nearly roughly 1 in 10 wells that we had tested exceeding thresholds for these contaminants and 40,000 wells countywide, that means we potentially had 4,000 contaminated wells out there unknown to the users of those wells. And so after considering this issue with a number of stakeholders and the county manager's office and looking at the resources that we might have available to our program and what might be possible. In 2019, we mounted a notification campaign with the goal of notifying as many well users as we could in that more susceptible area about the potential for these contaminants. So our goal here was primarily notification based on that paradigm that the well user, well owner is essentially the water system operator and responsible for the maintenance and monitoring of their water supply. But we had important information to share with them. We were able to obtain a one-time increase in funding, primarily to pay for overtime, for some publishing costs and contracted costs. We recognize that if we were to notify thousands of well users about the potential for contamination, that our program, which consists of 7 staff members, 6 at the time, including myself, and tests about 400 existing wells a year, we would quickly be swamped with the response, even if it was a fairly small response. And so we recognized that commercial laboratories were going to be very important to this notification campaign. We also recognized that we would need to be able to support lower income well users who might not be able to afford the full price testing charged by a commercial lab. And again, going back to the geology, recognizing that the geology does not stop at the county line, we recognized an obligation to inform neighboring jurisdictions about what we were doing. There's a whole other story in the development of this campaign, but what that ultimately resulted in is we sent 19,000 8-page notices out to places where we suspected there were private wells in use. This would be any place where we had a well permit on file, but also properties where, based on the extent of municipal water coverage and private utilities and things like that, we suspected there were existing wells that we had never inspected or observed. So 19,000 addresses got this notice in both English and Spanish. And included information about what the health threat was, the importance that laboratory testing was the only way to know for sure. It included information on laboratories and how to reach out to them and get your well tested. And links to information on the website about where to find more information, how to get your well tested at low cost if you needed support with that. We, at the same time, established a dedicated web page with a simple URL, wakegov.com/wells, so that people could go online, read the same information that was in that flyer, but additional information as well, such as an interactive map where they could plug in their address and find out if they were actually in the area affected by the notice or not. And also find information about community meetings and so forth. I want to emphasize the importance of commercial labs to this. We knew that we did not have the capacity, so the next step was for us to identify laboratories that would have capacity. And through that process, we identified 4 laboratories that were certified by the state of North Carolina for the parameters that have drinking water lab certification, which would be uranium and gross alpha. But we also had capability to test for radon in water, which does not have a lab certification. And also we're willing to do business with the general public as opposed to working primarily for engineers and consultants and more technically sophisticated customer groups. And after talking with those labs and understanding costs and how they deal with the customer and so forth, we also recognize that most of the samples that were going to be submitted to these labs were actually going to be collected by the residents themselves. Radon in particular is very sensitive to sample collection methodologies, so we put together a video online of sample collection to make sure people knew how to fill a 0 headspace vial. And we also knew that any of these laboratories, if they provided test results to a customer that were not good, their first advice to the customer was going to be contact your health department. So we needed to have a plan to assist people in understanding their test results and what it would mean for them. We also wanted to make sure that lower income residents could afford the testing. Thankfully, a few years before, we had gone to our county commissioners and obtained authorization to provide discounted testing fees for lower income residents. Anyone under 2.5 times the federal poverty guideline can qualify for a 50% or even an 80% reduction in their fees. And in preparation for this campaign, we revamped the qualification process to make it accountable for one, but also to make it very simple in terms of the amount of paperwork that the resident would need to provide. And essentially, the resident can go to a county facility, obtain a form and simply self-attest that their income level is below the threshold on a table, and have a notary there at the county facility notarize that statement for them and submit it to us. And that's all the qualification they need to give us. They don't have to send us W-2s and so forth. So we recognize that low-income residents in qualifying for assistance programs in general face a high paperwork burden. And for the level of service that we are subsidizing here, we didn't think it was critical to have such a high paperwork burden, and also that we didn't want to be stewards to a lot of personally identifiable financial information. So this keeps things fairly simple for us and for the well user. We held a series of community meetings after the mailers went out. We held 6 meetings on 2 different dates at 3 locations throughout the affected area, just to provide general awareness. What is the issue? How do you get your well tested? And things like that. And then after about a month or so after the initial mailings went out, we began a series of monthly technical assistance meetings to help people understand their test results. This is a shot from one of those technical assistance meetings. This was some of the most fun work that we ever did. We had large numbers of people show up for the first few, and with just 5 or 6 staff, we would sit people down at tables based on which laboratory they had used, because each laboratory had a different reporting format. And then we would have staff simply walk them through how to read their test reports as a group, and then talk to them individually about what those test results meant for them. Um, so this was a lot of fun for us to actually meet face to face and provide this kind of support for people. But one thing we recognized happening early on was that the well users were talking to each other, and they were sharing stories. And as time went on with these technical assistance meetings, we began seeing people who had hired a treatment installer to fix their problem, talking to other people about their experience with reviewing and vetting different contractors, things like that. And so we were really enjoying this and saw a lot of value in it. We kept these running until we were forced to stop basically by COVID back in February of last year. The resident response to the campaign was pretty large. We had over 350,000 views of our webpage. We fielded over 1,300 calls. We had to have an outside call center to do that. Otherwise, it would have, in the initial 2 weeks, the intensity of calls actually would have brought down the county phone system. Fortunately, we had anticipated that and lined up the call center ahead of time. We had over 100 residents obtain financial assistance with their testing through the county, and over 600 showed up for the initial community meetings. And though we didn't do most of the testing, we kept in touch with those commercial laboratories, and based on reports from them, we're estimating about 1,200 additional wells got tested during the 6 months or so of the campaign. So while that's 1,200 wells out of 19,000 may not seem large, it's still 3 years worth of testing if we had been trying to do it ourselves. So it's a significant increment. And I think we've seen that in general, the awareness of this issue has reached a new plateau where real estate agents and other professionals are much more aware of this issue now, and our baseline level of voluntary testing for these parameters is higher now than it was before. Our next steps in this campaign are heavily centered around new data. So though most of that testing happened through commercial laboratories and we don't have access to that, we do have a couple hundred new test results since we launched the campaign that we are using to remap the issue, make sure our recommendation area and our testing requirement area match what the data show us. And then we're going to use that data to share with planners in the municipalities and the public utilities so that they have access and awareness of contamination issues that are out there. The plan there is to share that in an interactive map format so that the data stays live and stays current. And as those planners and those utilities may be planning infrastructure improvements or annexations and so forth, they have this on their radar and can consider this along with other factors that might affect their plans. And lastly, we'll be continuing with our targeted outreach, taking that mapped data and looking at specific areas that had low testing rates through the campaign, and making sure that those neighborhoods get specific guidance that we have found not just the potential for contamination, but we've actually found a contaminated well in your neighborhood, and drive those more targeted messages home there. And we also want to continue serving, providing outreach to professionals that serve those well users, the real estate agents, pump installers, treatment installers, and so forth, just to make sure that they're aware of this issue and getting testing at those opportune moments. Real estate transactions are a great opportunity for this. A number of home inspectors we've talked to and trained previously, if they were called out to do a home inspection on a house with a private well, they might collect water samples for bacteria and nitrate. And now we're seeing that they are requesting more extensive testing, which is a great opportunity during that home transaction, real estate transaction, to address the issue. move on now to mitigation and a few aspects of that that are some pertinent to this subject. So one of the complications of mitigating this issue is with any private well issue, it's always going to be very site specific. And in particular in Wake County with sort of a patchwork of different public water systems out there, the availability of public water supply is one of the variables we'll need to look at. We don't have a county-wide water system, so we can't just direct people to connect to the county-wide water system. We have to look and see, is there water line available to you? And then help the resident get in touch with the municipality that operates that water system and navigate connection to it. In some cases, the municipalities won't connect someone who has not been annexed into the municipal boundaries unless we provide some documentation to that municipality that there's a health threat here that could be alleviated with connection to their water supply. We also have to look at, again, the contributions of soil and water to the indoor air radon levels. The residents' financial situation and their lifestyle is going to play into this, especially with regard to radon. If you're a person who likes to take a long, half-hour-long hot shower every day, then radon in your water is going to be more of an issue, more of a concern for you. If you are, a single male who takes a 3-minute shower, maybe radon is not so much of a concern to you. And obviously fixing the problem is going to be, generally speaking, is going to be fairly expensive. And if you have not planned for that, regardless of your income, if you haven't planned for it, that's going to be a bit of a hurdle. The specific mix of the radionuclides found is going to be important. And then levels of what some people call confounders, these aesthetic parameters, iron, manganese, hardness, and pH, are going to be important for choosing and designing a treatment system. So again, radon can come in through the soil and through the groundwater as well. This is why we have radon and air testing as part of our test package and part of our recommendation to well users. Just to share an anecdote, we were helping a homeowner whose radon levels in her water were about 13,000 picocuries per liter, and the radon in her indoor air was something like 20 picocuries per liter. And by some rules of thumb, we could surmise that the majority of her radon in air problem was actually coming from the soil and not from her well water. She had very limited funding available, and so in her case, it seemed the most cost-effective approach would be to spend the limited money that she had on mitigating the soil vapor problem, which is about a $1,500 repair, as opposed to mitigating the radon in water, which was going to be almost 10 times that amount. But each one of these is going to be very case specific. You have people who have a history of stomach cancer in their family, who are going to be much more sensitive about radon levels at lower levels, and may have more incentive to deal with the radon and water problem. In terms of radon and water, your treatment options, if you don't have public water available, if you've decided that the radon in water is the problem you want to fix, it's all going to have to be a whole house or point of entry approach. And that's simply because every place that you're using water in the house, you are putting radon gas into the air. And within that, there are two fundamentally different approaches: the aeration or bubbler system, which is going to be more expensive up front, but generally more effective, and granular activated carbon, which is not the approach that we recommend to people within Wake County. With an aeration system, you can see the actual aeration unit there on the right. It's essentially a chamber that has pipes in it. A blower sucks air in from the basement, wherever this utility shed, wherever this is installed, and blows a mist of air into the water, into that chamber, and then the air is vented outside above the roof line with the radon. Um, let's see. These units, the aeration unit itself is about a $5,000 or $6,000 unit. Um, and then activated carbon, as opposed to volatilizing, taking advantage of the fact that the radon is volatile and sending it outside the house, granular activated carbon takes advantage of the ability for volatiles to adhere to granulated carbon. Most people are pretty familiar with this. If you've had an aquarium, you probably had an activated carbon filter there. A lot of people have activated carbon filters in their refrigerators and so forth. But this is one installed at the scale of a domestic well. We can see here with 2 canisters filled with activated carbon, sampling ports in between so that you can detect breakthrough, so forth. And the issue here, and the reason we don't recommend these, is because you are trapping the radon on that carbon. And radon is not the end of the story in terms of radioactive decay. The radon itself is going to continue decaying into multiple other radionuclides that are both alpha and beta emitters. We've heard anecdotes about carbon canisters that have basically trapped so much radon that as the decay has proceeded over fairly short half-lives, those canisters have actually gotten hot or have tripped radiation detectors at solid waste facilities and so forth. Those are anecdotes. I don't know of any comprehensive study about the disposal of the spent media, but ultimately these activated carbon systems will have spent media that has to be disposed of, and it can create either a real or a perceived disposal problem. We've heard from water treatment installers who say they won't touch an activated carbon system that's been used on radon because they just don't want to be left holding the bag. And so there's some hesitancy out there, and it seems simpler for the homeowner if they're simply blowing the radon outside of the house and just getting it out of their house altogether. The bubbler systems, another thing that drives the cost up with a bubbler system is the fact that you're blowing air through water. And so anything that's in the water that's not already oxidized is going to oxidize. So they're susceptible to fouling by iron and manganese and other minerals. But because the pretreatment is required, this is also an opportunity to address other radionuclides in the water. So if you have well water that contains not only radon, but also uranium and potentially radium or others, you can use ion exchange pretreatment to reduce the iron levels, but also to remove the radium and uranium. This shows an example of one of these systems where on the right you can see there are 3 different, look like garbage cans, but each of those is a different treatment component. I think in this case there's anion exchange and cation exchange components in there. Radium being chemically similar to calcium is going to respond to cation exchange, which is a conventional water softener, but we urge people to recognize that it needs to be designed to deal with the contaminants that are present. Uranium, on the other hand, has a reverse charge and has to be dealt with through anion exchange. And so this is a system that has both of those components in place. The cation exchange is dealing mainly with issues of hardness and iron, and anion exchange dealing mainly with uranium. All of that before the water reaches the bubbler system over there on the left, and radon then vented out of the house. These systems also require a pressure tank after a second pump and a pressure tank after the bubbler system to repressurize the water up to house pressures. There are a couple of immediate or short-term options for people who have radon in their water. You get that initial test result and you're understandably alarmed about high radon in your water. And it's going to be a while before you can get someone in to put in treatment, so forth. So we recommend to people that they turn on their exhaust fan in their bathroom whenever they're showering. Keep it on for 30 minutes after showering because there's still water trapped in that bathroom that's going to continue off-gassing. And we also recommend that people look at the sizing of their exhaust fans. If you're seeing a lot of fog build up, like here in the picture, if your mirrors are fogging up even though your fan is on, then you may have clogging. You maybe need to clean the exhaust fan. Maybe you need a larger exhaust fan to really move the air through the bathroom. Any of those things, not as good as actually treating all the water coming into the house, but much cheaper and generally something that can be done fairly quickly to start mitigating the impacts. In terms of the mineral radionuclides, you've got a couple of different, fundamentally different approaches. Whole house ion exchange is going to be the most comprehensive. And then if you really only have a mineral radionuclide problem with uranium or radium, reverse osmosis is going to be a viable option for you, since we're dealing primarily with an ingestion risk. Some of the challenges we have with mitigation, number one, I would say, is installer certification and experience. There is, at least in North Carolina, there's no regulation of treatment installers, so there's not a professional certification. There is an optional trade organization, Water Quality Association, offers various certifications. We haven't had anyone within Wake County who carries those certifications. We have been able to find installers who seem qualified to do this and have some experience with it. We've had other installers who initially were not experienced with this, and that led to installation of a lot of carbon systems in a couple of cases that we would rather have not seen go in, but we would rather have seen aeration systems go in. But we have also seen that by reaching out to the treatment installer community, those who have little experience are learning more and they're applying those lessons. But it's tricky for us as a county health department. We can't recommend anyone. There's not a certification that we can point to help people screen contractors. And there are a lot of contractors out there. Well, maybe not a lot, but there are some treatment salesmen who will install a water softener on any well and even on city water supplies, whether you need a water softener or not. And we try to encourage well users in general to, before they start that conversation with someone who wants to sell them a water softener, get comprehensive testing and then share those test results with any contractor you talk to and make sure that the system they install is going to address the contaminants that have been found. Technical complexity is another issue here. You have people who've been drinking this well water all their life and never really thought about it. It always came out clear and plenty. And now suddenly they have to take in 45 minutes worth of information about their drinking water and understand what to do next. And lastly is the cost. As I mentioned previously, if you haven't been planning for it, regardless of income level, that's going to be a hurdle. But lower income people in particular are going to have a hard time accumulating the savings. And in terms of financial assistance programs, there really are only a handful of low interest loan programs for well users at the lower end of the income scale. And that's about it. North Carolina operates an alternative drinking water fund that is limited to funding alternative drinking water for man-made contamination. Similarly, the EPA has an emergency response or emergency removal action branch that we've worked with on man-made contamination. But if it is naturally occurring contamination, they are prohibited from touching it. And so the well owner is left to deal with all of the cost on their own. There's a number of sources here. I want to highlight again the State of North Carolina's Radon and Water Advisory Committee report and acknowledge Ted Campbell's role in promoting that. And leave it at that.
Thank you, Evan. Thanks so much for sharing your experiences and insights on radionuclides and private wells. Just as a reminder to all of our attendees, please do use the Q&A box to drop your questions on the content. I did receive a few questions via the chat box, so Evan, I'm going to go ahead and read them out to you. So the first question comes from Senna on what geological factors impact the presence of radon, and what role does urban planning play when considering new construction for private wells?
Okay. Well, the geological factors, I would say, we're looking mainly, the most susceptible formations are younger granites. So in our case, it's a Pennsylvanian aged granite that's about 300 million years old. Those formations in general are going to be more enriched in uranium, which leads to the decay through to radon. Different geologic terrains will have some different experience there. In terms of urban planning, we do have a subdivision review process within the county that our program participates in. And so whenever a new subdivision is proposed, currently our role there is to evaluate what's the proposed water supply. And if they are proposing to use private wells as the water supply for that subdivision, we go ahead and notify them up front that if they're in this eastern half of the county, we anticipate that 20% of the wells in that county are going to require treatment for uranium in that case, since our regulation only covers uranium at this point. There's not really a more proactive approach than that. We're trying to build towards that through some of the data sharing that we're beginning right now.
Great, thank you. We received another question regarding the RADS packages that you mentioned, specifically on its availability and success. Was this a proactive or a reactive measure?
Well, it was reaction to the data that we had showing that uranium was a fairly pervasive problem within the county. We put this recommendation out on our website, so it's a fairly passive initial step at outreach, and began giving presentations to it to essentially anyone that would listen to us. I'm not sure if that directly hits the question.
It does, thank you. As I was listening to your presentation, I was thinking, with no single drinking water standard for radon, how do you communicate risks to private well users in Wake County? And what are some of the challenges that you've encountered with communicating risks?
Yeah, so we have in our standardized communication, if we're sending test results out to the resident, we include a table that shows the relevant thresholds. And actually with regard to radon, we include both the 4,000 and the 10,000 thresholds that were identified by the Radon and Water Advisory Committee. And we categorize 4,000 to 10,000 as moderate levels, and above 10,000 we categorize as high. And along with that, one of the recommendations coming out of that statewide report was particular phrasing about consider. So if you're in the moderate range, we use the language straight from that report that you consider mitigation of the water along with consideration of the soil issues. And if you're at the elevated or the high range, is actually recommend treatment along with consideration of the soil issues. It's not crystal clear, and we've had people who say, well, I'm not in the high range, simple decision for me, I'm not going to do anything about it. And we've had other people who were in the moderate or even the low range who said, I'm really not comfortable with the radon in my water, and I'm going to aggressively deal with that. The main thing that we keep coming back to in risk communication is we repeatedly hammer on make sure you've tested your indoor air before you spend any money on fixing radon problems, because we don't want people to, spend $10,000-$15,000 on radon in the moderate range and miss the fact that most of their exposure to radon is actually coming up through the soil.
Great, thank you. Anthony asked a question with respect to adjacent properties with differing levels of radon and well water. Do you know if well depth is a factor?
We don't. We unfortunately we have limited data on the depths of the wells, and we haven't had the opportunity to do a really definitive study on that. I think a lot of it depends on the nature of Wake County's groundwater is that it flows in fractured bedrock. And so depth may be one factor, but it's also going to be which particular fracture your well intersects, and the residence time of water in that fracture, how quickly it flows through, and its degree of interconnection to other fractures. And so depth is going to be sort of part of a multivariable analysis there.
Okay, thank you. You mentioned a lot of excellent resources in your presentation, and we did get a question with regards to something that you shared about an 8-page notification. Someone asked, can you provide an example of what the eight-page notification included? And also, in the same vein, how would a resident with no internet access to maps and videos access those?
Okay. So the notification, if you go to that website there on the discussion slide, wakegov.com/wells, um, that website contains all the information that was in that notification, mostly verbatim, except that the website is all in English. Um, the mailer was the approach that we used to address the fact that some people would not have internet access. So we provided them with phone numbers for the county. Um, we provided that actually that call center was available 24 hours a day, 7 days a week for the first 2 weeks or month of the campaign. And we had people on the call center who could speak Spanish and receive those calls. Um, and so that was our effort to address people who could not access the internet, was to give them phone numbers. And likewise for the commercial laboratories, we made sure to include phone numbers as well as web addresses for those commercial laboratories in the paper mailer, and then followed up with the community meetings, press conference, and things like that.
Great, thank you. I think we just have time for one more question. Um, from the sound of it, Evan, it sounds like Wake County launched an incredible outreach campaign on private well testing education and awareness. In your opinion, what part of the outreach campaign was most effective?
Hmm. Um, I think the community meetings, both the general awareness meetings and the follow-up technical assistance meetings, um, a lot, what we anticipated and what we experienced was that we sent this information out in paper, we put it on the web, but what we anticipated and what we actually saw was that people wanted to hear the exact same information spoken to them by a real person. And so, having a call center there with people who, in many cases, were simply trained to read through the notification that we had sent out, find the relevant section, and sort of rephrase things for the caller, but also putting ourselves out at these community meetings and making ourselves available for a few hours directly so people could question us and get a sense of whether they could trust the message coming from us. I think there's a lot of mistrust out there, and that's a challenge for us. So I think dealing with people face to face and finding um, places where they're willing to meet you and talk to you face to face is really key.
Great, excellent. Well, that was amazing. We're almost out of time for our session today, so let's wrap it up. I want to thank Evan for his time and sharing his expertise on radon safety and treatment in private wells. I want to thank all the attendees for participating and asking questions. As a reminder, please do take the survey that's going to pop up as soon as you close out the webinar. And speaking of surveys, if you are a private water network member, then please do take the annual survey linked on the announcement widget on the private water network community homepage. I'm also going to drop that in the chat box just for easy access. Please do take that survey because your feedback is critical for program improvement. And with that, thanks again.